Yeah, it's a pleasant morning. Our project is just a little based on the case studies. As I was a little child, I was just admitted in our hospital with a critical case. Okay, we are just going to present my lifestyle in this case. So let us see what I have just undergone to my life. It is a project of life of the patient. Let us be made explain this.
The chief complaints of the baby Bhupesh, there is a doll-like face and the fatty cheeks due to the hyperlipidemia, and the extreme is lower extremity and the upper extremities are very thin, and the abdominal distension due to the massive hepatomegaly. And then the prenatal history is
Work history of baby Bhupesh is in prenatal period there are no significant issues, and he was a full-term baby and normal vaginal delivery with a normal birth weight of 3.4 kilograms, and he cried at immediately after birth. And past history is also admitted previously for the same complaints,
and there is no history of seizure and recurrent infection. The family history is their cousins also have during their infancy stage they also one person died due to this liver disease. By this statement we will conclude this is a somewhat inborn metabolism. Now the diagnosis.
Lab investigation revealed that in AB analysis, there was high anion gap due to metabolic acidosis, due to lactic acid increase and uric acid increase. Due to hepatomegaly, there was enlarged liver enzymes like ALT and albumin AST. There was hyperuricemia, hyperlipidemia, and fasting hypoglycemia. The diagnosis was confirmed through liver biopsy. In liver biopsy, it was seen that numerous enlarged hepatocytes in mosaic shape with clear cytoplasm due to abundant liver and glycogen liver and lipid vacuums.
So before getting into the mechanism of von-Gierke disease, I would like to explain the history of this disease. Von-Gierke disease was explained in literature in 1929 by a German pathologist called von Gierke. Although it has similar conditions with several other diseases, previously it had been described by many others, von Gierke was the one to tie together all the different strands and establish it as a pattern of an abnormality called a glycogen storage disease. So this type 1 disease is an autosomal recessive disorder. It is caused due to the lack of the enzyme glucose-6-phosphatase, thus affecting the final stages of gluconeogenesis and glycogenolysis. Therefore, glucose-6-phosphate will not be hydrolyzed to glucose, causing glucose-6-phosphate to be deposited in liver, causing hepatomegaly. And since glucose-6-phosphate cannot be converted to glucose, it causes hypoglycemia. And this glucose-6-phosphate alters its pathway to become dehydroxyacetone phosphate, which further becomes triacetyl glyceraldehyde, causing hyperlipidemia. It also alters its pathway to ultimately become uric acid, causing hyperuricemia. Now I hand over to Bhagarat Swami to explain type 1B disease.
Hi everyone, now I am going to explain about the von Gierke disease type 1B. In this condition, the glucose-6-phosphatase enzyme is normal, but the glucose-6-phosphate transferase enzyme is not normal, so it will not allow to transfer the glucose-6-phosphate into the endoplasmic reticulum. So the glucose-6-phosphatase enzyme is not able to act on the glucose-6-phosphate to convert the glucose-6-phosphate into the glucose. So the glucose level in bloodstream is low and it will cause the hypoglycemia.
Now symptom mechanism we are going to see. The glucose-6-phosphate is not converted into glucose because the deficiency of glucose-6-phosphatase enzyme. The glucose-6-phosphate is undergoing various pathways. First, the glucose-6-phosphate undergo glycolysis pathway. It forms pyruvate. Due to increased pyruvate, the pyruvate converted into lactate by lactate dehydrogenase enzyme, which causes lactic acidosis. Then, as pyruvate form acetyl-CoA. The acetyl-CoA converted into ketone body. Due to increased ketone body, it causes ketoacidosis. The ketoacidosis and the lactic acidosis both form metabolic acidosis. Glucose-6-phosphate undergo HMP shunt pathway. In HMP shunt pathway, it forms ribose-5-phosphate. Ribose-5-phosphate converted into pyrox converted undergo impurine synthesis form uric acid, which cause increased uric acid in the blood, cause hyperuricemia.
The clinical symptoms are seen via hologram.